Hello, happy Wednesday, or I guess happy Wednesday evening. It's time for a Soulibration. I am your host, Shameika Rhymes. Let me know in the chat, how are y'all doing this evening? How's your week going? And let me know where you're watching from. I love seeing, you guys are from all corners of the world tuning into Soulibration. But I also want to know, are you struggling to lose weight? I don't know about y'all, but I've had those moments where it's like, come on, I'm trying to get this last little bit off and it's just not budging, or the scale's going the opposite way and it's very discouraging. So let me know if you've had that issue. So remember to share this live stream with your network, because there may be somebody, your mom and them, somebody that would like to know more about. We're going to be talking about gut health and weight loss. So they might want to know what that connection looks like. And if you have any questions during the show, please drop it in the chat and we'll get to those throughout. So tonight, like I said, we're talking about weight loss. We're taking a look into the complex world of gut health and weight loss, that just trying to see what that link looks like. And so gastroenterologist Dr. Janice Laster, I'm gonna get her name right, Laster, will share the crucial role of gut health and overall well-being. We're going to talk about weight loss drugs, their potential side effects, and some effective strategies to maintain weight loss. We're also going to take a look at some surgical procedures that can help with weight loss or to help you get towards your goals. So let me let you know a little bit about Dr. Laster. She's board certified in internal medicine, I swear I can read, y'all. I promise I can. Gastroenterology, obesity, medicine, and nutrition. She completed both her internal medicine residency and her fellowship training at Georgetown University Hospital in Washington, D.C. And so let's welcome Dr. Laster. Hi, how are you?
I am great. How are you doing tonight? Thanks for having me.
Yeah, I swear, I was like, I cannot get these words out tonight.
Nobody can say gastroenterologist, which is why we shortened and just say your GI doctor, because nobody
Yes,
can say
there you go. GI. I was like, sound it out. I practiced before, I promise. It just was not working. But I see we've got someone tuning in from Arkansas, and we've got people like all over tuning in. So welcome everybody in the chat. So we're going to kick this off because obviously the title of the show was talking about the microbiome connection. So what is that? What is a microbiome? I hear it a lot, but I don't know what it is.
It is such a buzzword right now. But it's been really, really fascinating for us in medicine over maybe the last 15, 20 years as we start to learn a little bit more about them. Microbiome basically is a fancy word that just means all of the bacteria, all of the fungi, all of the yeast that sort of live among us every day on your skin, in your gut, everywhere. And it's sort of this symbiotic relationship, meaning we sort of work together. And the problem with the microbiome is sort of when we get an infection is when there's like the good guys are kind of wiped out. And so you have good microbiota and bad microbiota, right? But normally they're kind of kept in this beautiful little balance where you do have some, of the bad group that can sort of cause you to have illness, but usually they're kept in check sort of by the good guys, right? And so there's been a lot of research looking into sort of what this correlation is with weight gain, with chronic diseases, with mental health, with sort of every single thing you can think of. There's been links and there's been ways that have shown sort of a link with the microbiome and overall gut health. So the reason people will say your gut is your second brain is because people will say, oh, I feel it in my gut, or all these other kind of sayings. It's kind of funny because it's like, oh, it's sort of true, right? Or when people say, oh, I can't live without something. Well, it's kind of true because you've sort of trained your gut to sort of make you crave certain things. And these are the bugs it's the environment you've created. And those are things you want to live too. And so it makes you crave certain things. So it's basically a collection of bugs that live among us that help us to thrive as well, that we kind of created through our diet, through your lifestyle, through medications you've taken, the environment you grew up in. So many things affect sort of that diversity and what type of bugs you sort of have in your makeup.
Okay, that makes me feel better about all the cravings, that it's because I've trained myself to want sugar or whatever it is. That's very interesting.
It's also easy to train it to do something else. So that's the beauty of it, right?
Yes. Yeah. So let's talk about that. How do you train your body to stop craving those things?
So it's actually kind of fun, and there's and so we get to do it in practice every day. And there's studies that shown us that it can change as quick as 7 days. You can change your microbiome, right?
Ooh.
And so I tell patients in the beginning it's difficult because you're used to having a certain thing every day, and you think like my one of my aunts will say, "Oh, I can't live without soda." I'm like, I'll kind of give you that because you've created an environment that wants like sugar, right? But so the first couple of days is hard because you really, really crave it. And those things want to live. So they try to make you crave it. But if you hold out those first couple of days, you'll start to notice, oh, I don't even think about it much anymore. And so I'll have
Mhm.
patients much months later that'll say, what did you do to me? It's so weird. I don't even think about, sodas anymore or
Mhm.
juice or some of these things I used to want every single day. And then once you get out of having it so often, you start
Mhm.
to notice, okay, you'll say people always want to test it, right? So they'll go and they'll say, oh, I hadn't had it in a long time. I decided I'd try it again. And they recognize when they try it again, that tastes weird, oh, I don't really like it
Oh.
as much as I did anymore. And so you get unaccustomed to those things because you created a new environment where you don't want those things anymore.
Wow. So is there some specific like regiment that or you just tell them just stop. Let's just focus on eating these other things or drinking these other things. Is there something specific?
It's everybody's really different. Depends on what people are starting and what their major sort of kind of cravings are. And usually I try not to tell people to stop anything cold turkey because that's difficult. The more you stop something cold turkey, the more you want it, right?
Right.
And so I try to swap things to healthy versions of certain things. So, for example, like a patient that likes sodas and drinks them all day long, it is going to be really, really hard to go from 6 diet sodas a day to none. And so
Yeah.
it's slowly weaning them down. And most times, if somebody is drinking that much soda, they're not drinking much water. And so they
Right.
probably have other symptoms. They're probably bloated. They probably feel dehydrated. Their skin is probably dry. They're probably tired. And so
Mhm.
I'll say, you know what, for the first week, if you go from 0 water and 6 bottles of Coke a day, then okay, let's start with replacing one of those bottles with water a week. And usually patients are like, oh, that's all you want me to do? That's easy. And
Mhm.
but what you don't understand that what I'm doing is I'm tricking you along this time with your
Wow.
microbiome, right? So I'm tricking you into your body craving more water because your poor little kidneys are crying at that point because it never
Right.
sees any water.
Yeah.
But over that period of time, you are slowly sort of swapping out water. So week 2, you may say, okay, instead of 5 sodas, now we're going to do 4, and you're going to do 2 bottles of water. And you're slowly sort of reintroducing something else. And so over time, your body is getting used to this new water thing. And now you're slowly like reducing. And then it's saying, okay, now how about at night you just have a sparkling water instead of a soda?
Mhm.
Uh, After you've done like a couple of weeks of weaning off of this stuff. And then people start to realize, man, I don't feel as fatigued. Man, I'm not bloated anymore. Wow, like I'm not snoozing in the morning anymore. I
Mhm.
feel like, I have energy throughout the day to keep going. I don't need something in the afternoon to keep me awake. And it's really because you're not dehydrated anymore. And then it's sort of getting your mind to sort of recognize, listen, stop thinking of those things as treats when really they were just a habit. And they weren't making you feel great. So it's not really a treat if you felt like crap over this period of time. And now you see the difference. And so it's getting people to recognize that difference and slowly
That
doing it.
now I'm like, have I been tricked? I think I probably have been and didn't even realize it until you just said it. And I'm like, wait, hmm.
It's fun. We love it. And I tell
Yeah.
people, I'm like, listen, I'm going to trick you over time, and you're going to look up in 6 months and say, how on earth did you get me to start doing this? And that's the fun part because it's kind of, if you do it slowly over time, then people
Mhm.
don't feel like they're being deprived of something. And that's the goal.
Yeah.
If you feel deprived, you won't want to do it. It's human nature.
Right. So, how does having that unhealthy gut microbiome cause or can create or contribute to weight gain?
Yeah. So I'll say it in the nerdy form and then
Okay.
I'll break it down into what that means. So when you have a diet, like most people in this country, and it's sort of been acronymed like the standard American diet or the SAD diet, right? Which is a diet that's mostly processed foods. When people don't get enough fiber, they don't get enough real food. Um, They're getting most of their calories throughout the day through ultra processed foods.
Mhm.
And that means foods that have a bunch of emulsifiers or additives to make them shelf stable, to make them cheap, and they make them sort of highly palatable, which means that they're super easy to chew and they're super soft. And so you tend to eat more of them, right?
Right.
And so that's what most people are eating. And those things sort of kind of wreck your microbiome because they're not actually completely made of real food. They're made of a lot of
Wow.
chemicals, emulsifiers, and additives. And your body doesn't really know kind of what to do with that. And so there's research that has shown, and some of them are in mouse studies, but we've been able to extrapolate them to human studies to see what happens. But what happens in your small bowel is that it sort of changes your makeup of your microbiome. It changes the makeup of what happens until there's a layer in your small bowel that keeps harmful things away from that. And that bacteria, that layer kind of gets broken down, and you have sort of then you have things that are able to cross over into their barrier, and that causes sort of an inflammatory process. And so patients, and they aren't able to, because your microbiome changes, you're not able to utilize energy like the way appropriately, right? So
Mhm.
if you have a diet that is high in fiber, high in real foods, your body is like, oh, I know how to use this energy, and I'm not going to pack it on somewhere. I'm going to actually utilize it to work to, work your brain or make sure your lungs are functioning. But people in this country will get fatty liver disease and elevated blood glucose and those things because your body's like, I don't really know what to do with this.
Yeah.
It's not really what I need. So I'm just going to dump it off in the liver and I'll come back and get it later. However, we keep having that diet day in and day out, day in and day out. And now it just stays in the liver. And that's how people get what's called fatty liver disease, or the new name for is MASL disease, metabolic associated liver disease. But
Mhm.
that's sort of where those things come from, and why people have pre-diabetes and then diabetes and then high cholesterol and high blood pressure. And then this weight gain, they're like, I don't know what's happening. Why am I gaining weight?
Mhm.
And it's really from this food that your body doesn't really know what to do with, causing it to just sort of pack it away in places and not utilize the energy sort of efficiently. So you get reductions in your microbiome, which then lead to like poor gut health. And most patients that come in to see me will have bloating, constipation, abdominal pain, heartburn, like indigestion. They all feel tired. They're all, they have all
Mhm.
these symptoms, which are signs to me of poor gut health, and sort of associated with their diets. And usually when we chat about what they're eating throughout the day, it's usually confirmed that, okay, this is what we're eating throughout the day.
Ah, okay. Well, so obviously it sounds like improving your gut health can lead to some weight loss because that's what a lot of people are wanting to do. Is that a fair assumption that that can
Oh
help with
yeah.
that?
Oh yeah, for sure. And like that's the first thing we do. Like the first thing we do is talk about what people are eating every single day, and like starting with those little things first. Like starting with things like sleep affect your microbiome, things like
Mm.
water intake, stress, medications you're taking. All those things affect your gut health. So we start with those small things first, and people can't believe they're like, I lost 2 pounds. How did I do that? Just from like drinking water and sleeping. I'm like, those are all things that affect your microbiome and your weight. But then it started starting with small things like saying, you know what? And again, it's thinking of a mindset of instead of thinking of what I can't have, I want you to think about what you need to have in the day, like a little bit of a checklist. And if you start to think of it as trying to get enough fiber in your day, for example, because most of us do not get enough fiber, which is why everybody in this country is constipated. And say everybody's constipated, right? But we're all worried about like fiber. I mean, like we're all worried about protein. I'm like, none of y'all are protein deficient, I promise. But everybody, no one gets enough fiber.
Yeah.
Um, and so starting with something like that and saying, you know what, let's make your initial goal after you're getting water and sleep and all that stuff. Let's make that first goal that you're going to get 2 to 3 servings of fruit a day and showing you what that is. And
Okay.
if I tell people, and then next, maybe we're going to try to get 2 to 3 servings of vegetables a day. By the end of the day, patients are like, are you crazy? Like I could not force myself to eat one more thing. And they're
Mhm.
like, how do you have time to snack today? I'm like, yeah, that was the purpose. To
I love
use
it.
sort of GI physiology to my advantage because I know fiber is more
Mhm.
satiating and takes longer to digest. It is
Mhm.
not a food that you're going to be like, it's easy to sit on the sofa and chomp down on a bag of chips. You look down
Right.
here, like, I ate that whole bag. How that happen?
Right.
But I was like, if somebody slices up apples and put them in front of you, you are not going to, I dare you to try to get through 3 apples. You know what I
Right.
mean? Like, you're not going to be able to do it. You will feel so full. So
Mhm.
you're not going to be able to eat as much, and it's more satiating. And so little goals like that sort of takes people's mindsets away from, oh, I can't have my fries or I can't have my chips,
Yeah.
to I don't have room for it. I'm not even hungry for it. I don't want it.
Mhm.
And so those are small ways in which we sort of slowly start with changing your microbiome, and then also helping with weight loss. And so people are usually shocked because I only make maybe one change every like 2 weeks or so. And they're like, oh, this is reversing. But it's also tricking you too to want to keep going, because you notice, oh, all I did. And this is working. Like, people think it has to be some big drastic thing. Oh, I have to
Yeah.
do a low calorie diet or no fat or no carbs. And I'm like,
Mhm.
those are not sustainable. You're not going to be able to keep that forever.
Right. Right.
And you're going to regain the weight back because it's not sustainable. So finding things that are sustainable that actually work in your life are sort of the things that are more effective.
So for the gut health, the microbiomes, because I feel like those are some tricky little things, aren't they?
Yeah.
Does that cause inflammation as well in the body? And if so, would an anti-inflammatory diet help with that?
So I love these words because I think people use them so much, and they just kind
Yeah.
of throw them out there,
Uh-huh.
but they don't cite. I mean, they're kind of like, they're sexy words to say, oh, it's an anti-inflammatory diet. We know
Right.
what an anti-inflammatory diet is: a diet that's low in processed foods and high in plant-based and
Mhm.
whole foods. That's an
Yeah.
anti-inflammatory diet. It just sounds sexier to say anti-inflammatory diet.
Yeah.
Right? But that's all it is. Like, patients will come in and say, well, I've been reading. I'm like, tell me more. And I'm like, you know what that is? The same thing we've been doing. I just need to give it a name so people feel like they're doing some fancy like
Yeah.
diet, right? But that's all it is. And it goes back to exactly what I was saying. When it's a processed foods, they're inflammatory by nature because they have all these emulsifiers and additives. And what
Mhm.
they really truly mean by causing inflammation in your body is breaking down that barrier in your small bowel so that things are able to cross over those barriers in your vessels that should not be there. And that's what's causing that extra inflammation. And we see it in studies, you can measure it. So I used to get labs that, like, something called a CRP, which is kind of a really non-specific
Mhm.
number. It's called C-reactive protein. And you see it in people that have autoimmune diseases or joint diseases. You'll see elevations in these markers, but you also see it in patients that have excess weight. It's usually people that have diets that are high in processed foods. And I
Mhm.
used to just get it for kind of research purposes because it was kind of fun to see it kind of go down and show patients that over time. Um, but sometimes insurance doesn't cover it, so it's not worth it. So I'm like, am I
Oh,
going
yeah.
to pay for just for funsies? So we don't get it all the time, but it's nice to be able to show that. And that's sort of one of the studies that was done at the NIH here in DC,
Mhm.
Maryland, where they did an inpatient study that took, because it's really hard to do nutrition studies because it's hard to get people to do all the exact same thing and put it down.
Right.
But they were inpatient. They were 28 days. They watched everything they ate, all of their movement, how much they ate. They gave them the food. So it was kind of a great study. And they showed people that were on the ultra processed food had higher inflammation numbers. And so it was sort of, our way of extrapolating what they were able to see. And like mice, they were able to cut them open and look at the inflammation later
Yeah.
down the line. But in humans, they were able to say, oh, this correlates because of the high inflammation markers they were able to see in the blood. So that is what they mean by inflammation. And all an anti-inflammatory diet is getting people off of processed foods, which, yes, we know increasing fiber in your diet, increasing whole foods in your body helps to increase the diversity of your microbiome. And
Mhm.
what we do know about the microbiome is what has been seen in patients that are healthy controls without chronic diseases. They have a higher diversity of microbiome. So they have multiple strains of different bugs. And that is sort of indicative of having a healthier overall gut health because you have a bunch. When you've like taken a lot of antibiotics, you're chronically sick, you're in
Mhm.
a hospital all the time, you eat a bad diet, you have very few phyla, and that's a sign of kind of poor gut health.
Gotcha. So let's double back to the fiber thing, but first let me remind everybody, if you have questions, drop it in the chat. But the fiber, how much should we be getting? I know for my nutritionist says I need to be getting 25 grams a day.
For
But she
women,
said
20 to
build up
25
slowly
grams.
for women. Okay. So what
Mhm.
about for men? How much should they get?
So they are a little bit less, like 18 to 20. But if I try to get everybody to get at least 20 to 25 grams per
Mhm.
day, when I calculated for
Okay.
most patients that come in, most people are getting less than 10 grams a day.
Yes.
It is tricky
Yes.
though. I will say it is tricky because you can't go from 0 to 100 either. Because if you
Right.
go from eating like no fiber every day to eating 25 grams of fiber, you will hate everybody around because you will
Yes.
you will like, my God,
Yes.
awful, because you'll feel bloated, and because it takes time to get your gut used to having that fiber because it has to actually work to break down
Mhm.
fiber. It's used to having processed food all day long,
Yeah.
so that doesn't do anything. But when it starts to get fiber, it's like, what is this that you are? What do you want? You want me to do something? Ugh. Um, but it's great because it starts to change your microbiome, and actually fiber is shown to sort of feed your colonocytes or your colon cells. So it's like food
Okay.
for your colon. But it also crosses the blood-brain barrier with these short chain, like it creates these things called short chain fatty acids, which crosses the blood-brain barrier. And one of the first things patients will tell me before they see weight loss, they're like, "Am I crazy or do I have more energy? Like I have less brain fog." I'm like,
Mhm.
"Nope, nope." The fiber is going to work. It is. That's why you'll see studies in like psychiatric journals as well with microbiome because they're finding links between depression and anxiety and sort of microbiome, that sort of thing too. So fiber is one of those things that we know can sort of increase diversity and improve sort of overall gut health.
Okay.
Yeah.
So, of course, I'm sure a lot of people are wanting to know about these weight loss drugs, and I'm curious as to, well, let's see, let's answer this question first from Patricia Woods. Do you believe eating according to blood type? That's a good question.
Good question. I hear that, and I ask this question a lot, and there's a lot, and there's the thing is there's not a lot of randomized control trials that says you need to eat according to your blood type. And so if there is, and it's always something that I'm leery about if it's things that are telling people, oh, you need to eat it, you need to cut out all vegetable, like some of these blood type diets can be a little wonky. They're like anything that tells you that you should be eating fruits and vegetables, I think you should side eye.
Mhm.
Anything that tells you that you need to eat meat all day long and you know it makes you feel constipated and bloated and not have bowel movements and you have high cholesterol and high blood, like these are things that you should stay away from. So I think all of these like diets are super sexy, but really what data has shown us is more fiber, more whole foods, diets that are low in, we know red meats are, so red meats and processed meats are carcinogens associated with colon cancer.
Yeah.
And so getting people to reduce those, and we know that patients in blue zones have minimal meat intake. And those are people that have the highest number of people that reach to age 100 without disease. So when
Mhm.
you put all of these things together, it is sort of eating whole grains, beans, grains, vegetables, fruits, getting in movement, getting in sleep, having less stress in your life, and minimal meat intake. And so having some, but not having the amounts that we have in this country every single day, all day, and the portions that we eat. So I think we don't necessarily need these sexy diets or just make it difficult. Like my patients all come in and they've all come in
Yeah.
with like, oh, I tried this and that. And they're like counting macros and I was like, no one has time for that. And I know
Right.
you don't. And that's why it wasn't sustainable. So let's just make this simple.
Yeah.
And that's what we try to do. It's just make it simple, something that you can actually stick with that actually feels good for your body.
So, bringing up going back to weight loss drugs. So,
Mhm.
will how do the weight loss drugs, and we can talk about the different ones, but how do those affect those microbiomes? And then, and what is that connection to actually losing the weight? Because don't you have to, if you get whatever weight loss drug it is, you have to eat right to make it last, right? So, can you talk a little bit about that?
Yes. So first, like weight loss drugs have become like this new craze now, but I
Mhm.
always tell patients they've been around for a very long time.
Mhm.
So that's the first thing. And I'm like, there's multiple medications. It's not just these GLP injectable medications that are out. So some may not be the right thing for you. And so you should really don't just go to your corner person who's like peddling
Yeah.
medication. You should be seeing somebody that is obesity board of medicine certified, or at least an endocrinologist or somebody that has certain type of certification, not just some random person,
Mhm.
because there's so many medications and it just shouldn't be, oh, I saw my favorite influencer that used Wegovy or Ozempic, so I'm going to use that one. No,
Yeah.
that's not, there's a lot of data that we have that should drive which medication we give you. So that's number one. There are oral medications that have been out for ages. So people who say you shouldn't use that medication because we don't have any data on it. But that's untrue. We have medications that have been around for decades.
Mhm.
And some of those are, one of them is called Castimia, is the brand name, and it's a generic form of has phentermine and topiramate in it. So those work really well for people who have really low basal metabolic rates, or for people who just feel like they are insatiable, people who feel like I get hungry within an hour of eating. And some people have fast gastric emptying, so those things work well for them.
Mhm.
Some people are emotional eaters, and one medication that works well for them is something called Contrave. And it's two old medications on that one. It has naltrexone and bupropion,
Mhm.
also an oral agent. And then the newer ones that came out, first I'd like to tell people that Ozempic is FDA approved for diabetes. That's what it was initially approved for. And then they went back to the drawing board. They said, oh, people are losing a lot of weight. Let's study this in people without diabetes to make sure it doesn't cause them to have drops in their blood sugar. Because that was
Mhm.
everybody was saying in the beginning. People like demonized it as you're taking medicine for people with diabetes and you're going to have, you don't have it, blah, blah, blah. I'm like, no, no, no. We studied this in people that did not have diabetes.
Mhm.
It did not cause changes in their blood glucose. This is not unsafe for them, right? That's
Okay.
not how the medicine works. And so that's why they renamed it, came with another medication, Wegovy. And the only difference is it goes up to a higher dose, right? Still injectable, same thing. And that one works on a hormone that comes from your small bowel, something that we already create. We have information about this drug because in older diabetes drugs that go back to 2005 that we've
Mhm.
been using, the only difference is we were using those medications daily. So they were injectable daily. Most people don't want to inject themselves
Right.
daily. And so over the last 20 years, there's been many medications that have been formulated in order to be dosed weekly, and some of them monthly. So a lot of psychiatric drugs have been made from a weekly medication or from a daily medication to weekly or monthly to make people be more compliant, right? So they use that same formulation for these medications. So that's one thing I tell patients is no, 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 no. I know your auntie said that no one knows about this medicine.
The auntie.
This auntie got something to say, okay? Meanwhile, the auntie has diabetes and high blood pressure and like still eating like yams every weekend, right? But they
Mhm.
will tell you that you shouldn't worry about it. So that's that medication, right? And
Okay.
then there's the last one that most recently came out is called tirzepatide. So one of them, and that one came from, it was Monjaro and then Zepbound, and went through the same process initially for diabetes and then for weight loss. So those are the
Mhm.
medications. That's first of all.
Okay.
Um,
Okay.
and so talking to somebody that actually knows how to do it, that's second of all. And third of all is recognizing that you have to eat on these medications, and you can't just, you have to be following up with somebody that shows you how to eat too. You can't just get to a
Yeah.
point where you're only eating one meal a day. That's not the goal. You can't get
Mhm.
to a point where you don't eat at all, or you're, the things you are eating is you're still stopping by Chick-fil-A every day, or that's all, like that is not the goal.
Like I feel called out right now.
And I always was on Chick-fil-A. Somebody gonna get me at some point. They are always, I always talk, and they like the first thing to come because they've been, their marketing agent is genius because everybody thinks it's healthy, right? And so I pull it up on my screen in the office and say, I want you to look at this nutrition label. I want you to look at, I don't even want you to look at the foodie. I want you to look at these sauces that you get. And how many do you get? Four, usually, 3 to 4. And they're like, and everybody's like, Jesus. I'm
Mhm.
like, yep, that's
Yep.
like
Mhm.
150 to 200 calories in the sauce alone. You haven't had
Yeah.
a fry, a sandwich, or anything yet. But yes, but you have to learn how to eat because the whole
Okay.
purpose of these medications are to, they're beautiful. They work really well because some
Mhm.
people, because of microbiome changes, because of habits, because of this fast-paced world we live in, because of so many other factors, there is so much food noise that it is so
Yeah.
hard to turn that off. I have patients that will, when they tell me what their thought process is every single day when as it comes to food and what they should eat, what they shouldn't eat. Oh my God, I
Mhm.
had too much of this. They're worried about a cupcake they had 2 weeks ago. And I'm like, how have you not gone crazy?
Oh.
Because they're constantly thinking about,
Mhm.
oh, I shouldn't have done that. And they're trying to say, well, I'm not going to eat dinner tonight because I shouldn't have had that. Now they're starving tomorrow. And they're trying, they're going through
Oh,
this
wow.
thing every single day. And it like
Mhm.
breaks your heart because you're like, holy crap.
Yeah.
That's what you go through. And this is what they've been
Mhm.
going through their entire lives. Most people have like been struggling weight for 20,
Mhm.
30 years. You know what I mean? Sometimes
Yeah.
people from childhood.
Right.
So it's really, really helpful because the way some of these medications work is they work on one part of the brain, the part of the brain called the arcuate nucleus. And that's sort of what controls appetite, energy expenditure,
Mhm.
feeling fullness, satiation, and hunger. And it helps people. People will say, is this what normal people feel like? Like this is the first time I'm not planning they're like all day I'm either thinking about food, planning what
Mhm.
I'm going to eat next, or beating myself up over what I've had. And then that's
Mm,
not life. Like,
right.
right. When I think about that as a person who does not struggle with thinking about that, I'm
Mhm.
like, that sounds miserable to think
It
about
does. It
all
does.
day long. So
Mhm.
when I hear people say you just need to move more and eat less, it like burns me up because you've never struggled with this clearly.
Right.
But people that I have that that come in and they see me, and these people, they're not lying to us when they say they're going to the gym. They spent all this money on these trainers. They've been working out 2, 3 times a day. Some people are like killing themselves in the gym. They're barely eating, and they're not seeing anything move. And
Mhm.
that's you feel like you start to feel like something's wrong with me, right?
Mhm.
Everybody else can do this when
Right.
actually not everybody else, because 42% of our country is,
Yeah.
diagnosed with like, obesity. So
Mhm.
they are great tools. But the big but is it has to be in addition to someone who's showing you how to eat, making sure you're getting enough fiber, enough protein, and showing you how to get that protein in throughout the
Mhm.
day. Make sure you get enough water, and then making sure you're doing weight bearing activity too. So to make sure you don't lose muscle mass, because that's the goal. You want to be losing fat mass, not
Yeah.
muscle mass. So we're trying
Mm,
to
glad you
change
said that.
lifestyles. Yeah.
Mm.
So that's the thing. And so you'll see some people that look a little different after they've been
Mhm.
on these medications.
Yeah.
You had all these things coming out about Ozempic face, Ozempic butt,
Mhm.
all this stuff, which I think is also ridiculous because we don't call it gastric bypass face or diet face or
Right.
like things can happen with anything. They're not just with medication. It's when you have gotten down to not eating enough and not eating, getting enough micronutrients, enough vitamins, enough protein, enough all of these things you need in your daily intake,
Mhm.
because you're not following up with somebody so they can follow that and make sure you're getting that in. So they are
Okay.
amazing tools for us to have, but in the right hands, at the right dose, with the right follow up, and making sure you're eating the right things with it so you can sustain it.
Well, I think that answered the question that I saw popped up earlier about if you recommend it that people try the new weight loss drugs, but that I think that sums that up. Um, and you guys, we probably have about 10, 12 minutes left, so make sure you get your questions in. So, of course, let's talk about weight loss procedures and surgeries.
Yeah.
Um, I don't know about many of them. So, and I'm sure there's, well, you did mention the gastric bypass. There's, I think, the sleeve. There's
Please. And there's
different ones like that.
endoscopic
Yeah.
procedures too.
Mhm.
So there's so many things that are out now. So those are
Mhm.
more invasive things, right? So most people
Okay.
have heard of the gastric bypass,
Yeah.
gastric sleeve. Gastric bypass is probably the most extreme that people do now, where you make the stomach pouch really small, but you also bypass a part of the small intestine, so you're not getting absorption
Okay.
into part of your small bowel. That one can cause nutritional deficiencies. It's like a longer recovery, and that's usually reserved for people that have a large amount of like weight to lose, right? Or
Mhm.
they have really uncontrolled diabetes because it's really curative for diabetes, or somebody that is not a great candidate for a gastric surgical sleeve because they have heartburn,
Mhm.
because a sleeve can make heartburn worse. So that's a good if somebody needs to lose like a lot of weight, right?
Mhm.
Like to the point where they can't do exercise because they have so much joint pain because they have so much weight to lose, like those kind of patients.
Okay.
Um, and there's the surgical sleeve, the gastric
Mhm.
sleeve. That's when they cut off just like a portion of your stomach, so you're left to about 30% of your stomach left,
Mhm.
but there's not bypassing anything.
Okay.
So those it's for patients that you less weight loss than you get with the surgical sleeve.
Mhm.
But even though these things have been around for a long time, they perfected. They've done a really good job at sort of having guidelines of sort of how to do them well. A lot of
Mhm.
patients don't want to do it because they've of all the things they heard. Everybody's heard of somebody that had a bad experience.
Yeah.
People are afraid to like look like certain people. They're like, oh my God, they look like they had surgery. So people don't want to do it, even though they're great, right? And then so now we've come out with things that are less invasive. So by endoscopy, so through the mouth. So you
Okay.
wake up, you go home the same day. One of them that we do is we suture the inside of the stomach to kind of fold it in on itself. So you're able to
Mm.
create smaller, sort of more tubular shaped stomach. And the idea was to sort of mimic the surgical sleeve. So you're now still creating like this smaller stomach. The difference is there's no incisions on your abdomen. You wake up, you go home the same day,
Mhm.
and it's reversible, right? Whereas with the surgical sleeve, you cut that part of the stomach off, it's gone forever.
Right.
Um,
Okay.
So that's a difference in that one. And then the other one that sort of that people like a lot, but it can have some side effects, is the gastric balloon. So we basically, with endoscopy still, is
Mhm.
inserting it into your mouth, into your stomach. You fill a balloon up to 500 cc's, and then you take the scope out. It takes like literally 15 minutes. Patient wakes up, they go home, they come back in 6 months. We remove. Well, there's 2 balloons now, 6 to 8 months, I'll say,
Mhm.
and then we remove the balloon. That one, the purpose of it is over time is showing people how to listen to their gut again, because that's another thing. We eat so rapidly in this country, and we overeat so much because
Mhm.
we don't take time to slow down, to know when you feel satiated. And so the
Mhm.
balloon forces you. You overeat with that balloon in, you're going to feel miserable and bloated, and usually vomit and have heartburn.
Mhm.
And so over time, you may do it once. You may do it once.
Right.
But then after that, you'll say, last time I didn't like that. I'm going to slow down. I'm not going to
Mhm.
eat as fast. And that's what I'm trying to teach patients in clinic anyway, how to slow down. And so when I
Okay.
do those procedures, it's really, really helpful because it's no trying. It's a hard stop. It is,
Mhm.
told me to drink that slowly. Okay, now
Okay.
I'm going to do it. You told me to chew and to put my fork down in between and not to keep shoveling food in my mouth, even though I wasn't done chewing.
Mhm.
But it gives you that moment to recognize you're satiated. And people will say, I have been filling my plate to the rim for nothing this
Mhm.
whole time. I'm actually satiated. You're right, with much less if I slow down and give myself time to hear those triggers. So
Okay.
those are, so it's a breadth of procedure. So it's like everything else that has evolved over time. We used to do
Mhm.
open heart surgery for everybody who had a heart attack. And now we can go through the thigh, you can go through the arm, and you can stick,
Yeah.
you know. And so everything has gotten a little bit less invasive. And so I love it because people are actually starting to care about obesity as a disease. Now it is a disease. People have struggled with this their entire lives, and it causes other diseases: high blood pressure, diabetes, joint disease, liver disease, like all these other
Mhm.
things that it causes. And so people are starting to acknowledge that.
Mhm.
Just as important as diabetes. So those other things that I would say, if somebody came in with the diabetes or high blood pressure, you would treat them. So why not the
Right.
patients that have
Mhm.
excess weight and have struggled with that for 30 years? Why is that not important?
So at what point would you say it is excess weight? Because I don't really know what is that marker of where you deem someone obese? Like, is it they're 20 pounds overweight, 30? Where's that marker?
Technology. And so we try to, in our clinic, we try to use sort of overall body composition and
Okay.
overall sort of metabolic markers. So does somebody have pre-diabetes or high cholesterol or high blood pressure or sleep apnea or other obesity related comorbidities?
Mhm.
And I have a machine that tells us what somebody's visceral fat is, which is what's around your organs, what
Mhm.
somebody's percent body fat versus skeletal muscle mass is. And that's like more precise ways to tell people what their parameters are. What most people have and most doctors have is just like BMI, which is we know is not a great way
Right.
to measure, but the way it came out, the way it was, came up with was not even supposed to be used in like medical scenarios in the first place, but
Mhm.
it's what we have. Because most people are not measuring your waist circumference and having this,
Right.
big machine that I have in our office to be able to do that stuff. So what we have is BMI, which we know was really created like looking at white males, so does not affect most of the population.
Right.
And they created even scales for like Asians and sub-Saharan Africans because they recognize, oh, we can't use the same scale. It doesn't really work very well for them.
Mhm.
But we don't have it for every ethnic group, right?
That was
So
my next question.
exactly. So
Okay.
not for every ethnic group. So it's not like a perfect scale for that. And so I look at sort of that is sort of one of the things that will get people sense to me. But usually it's when somebody has like my new patient today, her new diagnosis of pre-diabetes was a thing that was like, oof. Every
Yeah.
single year I've been watching this number go up, and now it's pre-diabetes or
Mhm.
diabetes, or if they get an ultrasound for something else and now they have fatty liver disease.
Yeah.
So this is usually like the wake-up call of, I thought it was just like 25 pounds of like, oh, no big deal. But now I'm recognizing it's causing my joint pain or whatever. So
Okay. So when you come off of that weight loss medication or you have whatever procedure, how do you keep the weight off? Is it you once you've just learned those new habits and ways of eating, it'll keep it off? Because I I've seen people that have gained all their weight back that they had just taken off, whether it was through either one of those things. So
Yeah.
how do they keep it off?
And that's the part that we talk about with patients all the time because it's hard. Because
Mhm.
when you lose weight, there's studies that have shown us that your body tries, it's really kind of annoying, but it tries to adapt. Because back in the olden days, your body will say, oh, this person is losing weight. We don't want them to lose weight and fade away and die. We got to make sure we're able to keep them at this weight because back then we didn't have this surplus of food. So it would
Mhm.
reduce what's called your basal metabolic rate. So what your body needed to function. And so that still happens to this day. So patients will come in and say, oh my goodness, I've been doing this thing. I was doing great. And now I'm doing the same thing I was doing months ago. It's not working anymore. And that's because your basal metabolic rate drops over that time of you losing weight because it's trying to preserve you, right? Or people
Yeah.
will say, I'm feeling more hungry because your ghrelin level, your appetite sort of hormone increases. So it's
Mhm.
really annoying. And so really the biggest thing that's what we work so hard with patients. After somebody has a procedure, we are following up for a year after that. It's not just like done
Okay.
because you have to change your mindset. It really, really, you have to go have, it takes a long time. Imagine somebody's been doing something for 25, 30
Mhm.
years. It takes a long time to like I'm like, even a year, I'm like, guys, it's 1 year versus the last 35, 40 years of your life of you doing a thing. Like that's a
Yeah.
drop in the bucket. And so it really is making sure people are able to keep these habits in place. So my patients who travel a lot, I'm like, okay, so you travel, that's a part of your life, right? You can't just give up every single time you travel and gain 10 pounds every time you travel, then come home. Like you're going to be
Mhm.
doing this for the rest of your life. Instead, we have to figure out a thing what we're going to do. You're going to travel with overnight oats. You're going to travel with your water bottle. You're going to make sure you have Greek yogurt in the morning. These are like going to be your things that you can control while you're away. And my
Mhm.
patient just came back from her international trip. She has done for her job every single year. She lost weight while she was there. She's like, yep, I continue my walking. I did this. I did that. I'm like, yes. She goes, people thought I was crazy because I would go downstairs every day and ask for soy milk and I would add it to my overnight oats that I brought with me on the plane. And it's just about planning. And it's really
Yeah.
showing, figuring out what patients, like what's going to work in their life because she travels a lot. I can't tell her to do the same thing that
Mhm.
somebody who works from home does. That's not going to work. You know what I
Right.
mean? So it's finding that thing that works for each patient so they can sustain it. And people will often ask, well, do I have to be on this medication forever? And I'll say most of my patients do not have to be on these medications forever. Now, I think there is a subset, and there's a lot of research going on to see what those phenotypes
Mhm.
are, because there are
Yeah.
some patients that I'm able to take down to a really low dose.
Mhm.
But then we may be able to titrate it to like every other day or something like that for like the oral agents, or maybe they need the injectables every week. But some people will, because of those sort of intricate interplays between hormones, maybe they have PCOS, maybe they have some other thing that sort of
Mhm.
makes it more difficult for them. So maybe they just need a lower dose for a maintenance. But that's not everyone.
Mhm.
And most of the time is when we've changed their lifestyle, changed that microbiome, so they don't even want those things anymore. It becomes a lot easier, which is why they don't need those high doses anymore.
Wow, I have learned so much today, and I'm
Yeah.
not going back to Chick-fil-A.
I'm sorry, Chick-fil-A. I won't stop beating up on you. Somebody in the comments said they got a good. Somebody said, "Now wait a minute, they have good kale salad." I was
Right,
like,
they do.
I said, I'm sorry, but it's no. Most people going to Chick-fil-A are not getting the kale salad, so that's why I was laughing when I saw it. I was like, I'm sorry, you're right.
Yeah,
Uh,
I do substitute the kale salad sometimes for the fries, or I'll get a yogurt parfait, and then it'll hurt my feelings to be like, but no cookies and no granola. Just give me the yogurt with the fruit.
oh my
It
goodness,
hurts, but this is it's I'm learning.
it's step by
I
step, one thing at a time.
Yeah. So, how can people find you if they want to check out? Like, I don't know if you can see patients from other states or how that works.
Yeah. So I see I have licenses in a bunch of different states. So reach out, let us know where you are, and we'll see if we can sort of see you in your state. And my website is guttheoryhealth.com, and Instagram, I'm Dr. underscore Janice Laster. Very, very original. But guttheoryhealth.com is our website. So I'll have like a quiz on there so you can see what type of eater you are. So it's a gut health sort of just to see sort of what your habits are. So I think it's fun when people are able to like check that out. So they're like, oh yeah, I am kind of an emotional eater, or oh, I do get hungry really quickly. So
Mhm.
it's kind of fun.
Oh, yes, I'm gonna go check that out because I would love to know what kind of eater I am. So I ask all of my guests this. Well, actually, let me make sure there's no other questions. I did see one more question. It was they were wondering about having a bowel movement after most meals, wondering if that was normal.
Yeah. So that's a good question. And the answer that most people don't want to hear is like, it depends. So it depends on sort of the form, like sort of what type of stool,
Mhm,
because it can be very normal to have stools every time you eat. Because when you eat, what happens is you get a trigger in your bottom that's
mhm,
called an MMC, that basically triggers and says, I need to make room for more stuff. And so it's not the food that you just ate that's coming out, which is the misconception. People think every time I eat, I get rid of it. No, no, no. It is the thing that you ate 10 hours ago that you're getting rid of that's already made it through your small intestines in your colon. And now you're triggering your colon to start contracting because your colon has said since, oh, more stuff is coming in, which means I need to eliminate things that are in the bottom here to make more room. So it's actually a sign of really good colonic health, unless you're somebody who's having runny diarrhea, waking you up at night, blood in the stool, a lot like those. So that's the caveat to it. So it can be very like normal and healthy. That a sign of really good gut health and fiber intake if they are formed stools that you're not straining, no associated pain or discomfort.
mhm.
But because it could just be a sign that you have perfect triggers that say, oh, I've eaten, I need to trigger my colon to contract because I need to get rid of some of this stuff so I can let this other stuff come in and digest properly.
Thank you for that answer. So I ask this question of all my guests: what feeds your soul? Now, it's so crazy to ask that now after we've talked about all the foods and eating things.
No pun intended, right?
Right.
It is when I see patients, when patients come back in and I can see that transformation from when they first came in and they
Mhm,
didn't think anything either, was going to help. And you kind of remember them saying, it's kind of like they feel like I'm just here just for a last ditch effort. I don't think
yeah.
anything's going to help. I've tried all of these things, whatever.
Mhm,
I'm just here. And you see them like 6, 7 months. Like we take a picture at their first visit and you can just see them, their picture, they just look,
aw,
and then you see them 6 months later, and I'm, able to show them their self from before versus today, that day in
mhm,
the office on the screen, and they're like, oh my God, that was me. And you can just see so much life left in them. And
yeah.
like one of my patients, the husband reached out to me and said, you gave me my wife back. And so when
Aw,
you see people like become themselves again, and you see
mhm,
people, one of my patients didn't want to go out with her husband anymore because she's like, I don't feel good in anything. That's
mhm,
horrible. Like,
yeah,
and so it's little things that are like life is meant to live, not just sit at home and just like, I tell people,
mhm,
my grandmother used to say, you're just waiting to die, and
yeah,
like, no, you should be living. And so when you see people that, they start telling you,
mhm,
oh, we went out here last week or here. And I'm like, well, who are you? When I met you, you didn't want to go anywhere. And
right.
so it's really nice that
Love that.
people, want to go out again. They feel like themselves again, and you can just see them like life coming back into them, or they
Mhm,
go to their primary care doctor and they get that pat on the back because now they're off of blood pressure medicine. Now they've reversed their diabetes and they're not on anything anymore. So that does it for me. It's like it's really
mhm,
really fun, and they're not hangry. One of my patients was like, you know what, I was able to do this before, but I was hangry and I was not a nice person. And I was killing myself in the gym, but now I feel normal.
mhm,
And that's the goal for people to know that you can feel normal, whatever normal is. So
yeah. Oh, I love that answer. Well, I want to thank you, Dr. Laster, for joining me. You've got to come back because now I have 1,000 other topics in my head that just came from this conversation alone that we could talk about. But for everybody else, for more information on ways to lose weight and sustain that, head over to blackdoctor.org and catch up on all the articles over there. And as for me, I'll see you guys next Wednesday. We're going to do a kind of a part two talking about more weight loss. In this, I guess I'm calling it a weight loss series, but we'll be taking a look at bad diets and why they don't work. So let me know in the comments still, you can still let me know and I'll look at it later. But if there's other topics that you want to have or hear about on the show, so have a soul filled rest of the week and I'll see you guys next week.